This first case Articles on the Go feature is titled, Do You Have Sufficient Anesthesia Technician Coverage? Written by Paul Wafer, BS, MBA, RN. In my travels to different parts of the country, I see many different scenarios for the quality and the quantity of anesthesia technicians and technologists. The scope of practice performed by anesthesia techs varies considerably based on the state laws and credentials of the individual. In general, most facilities will use them to stock anesthesia machines and carts, clean and set up the machine between cases, and assist the anesthesia provider with doing blocks, starting lines, and difficult intubations. There are also devices such as video laryngoscopes and ultrasound units that require some expertise and attention after use. Advancements in technology and anesthesia technique have definitely made the anesthesia tech a valuable member of the team. So now the question is, how many anesthesia technicians do we need? To evaluate this, let's look at 3 different factors that help us make our decision. First, the ASA score. I start by allotting an amount of time based on the ASA score. For example, on a routine case that is an ASA 1 or 2, there will likely be only a small chance that the patient will need anything more than a clean anesthesia machine and supplies for the case. In this situation, I would allocate 20 minutes per patient. For an ASA 3, there may be a need for an invasive line or some other form of enhanced technique. For these patients, I would allocate a longer time for a percentage of the patients. For example, 30% would require 45 minutes, and the rest would require the basic 20 minutes. An ASA 4 would be allotted 90 minutes, and the most critical, an ASA 5, would require continuous assistance, so I would allot 300 minutes. Second, procedure type. Again, I start by allotting an amount of time based on the type of procedure. Low acuity procedures with a basic supine or lithotomy position would require the least amount of time, so again, I would allot 20 minutes. Cases that require some positioning but do not routinely require other lines or blocks would be in the second category at 45 minutes each. Procedures that include a regional block, invasive lines, and extensive positioning would require 90 minutes. And cases such as open heart, major trauma, and major neurosurgery may require continuous assistance. I use 300 minutes as a time allocation for these cases. And finally, ASAT staffing guidelines. The third way to look at this is to look at the number of anesthetizing stations to determine the appropriate staffing. For example, the American Society of Anesthesia Technicians and Technologists recommends the following: 1. General anesthesia, 1 per 4 rooms. 2. Cardiovascular anesthesia, 1 per 2 rooms. 3. Liver transplant, 2 per room. 4. Off-site procedures, 1 per 2 areas. And 5. Outpatient ambulatory services, 1 per 4 rooms during working hours. When evaluating the staffing, I like to look at all 3 metrics to see how close they are before deciding on the appropriate course of action. In most instances, the numbers are surprisingly close. If you are having trouble determining the appropriate staffing for your anesthesia ancillary support, try using these 3 metrics to determine your staffing needs. By considering the needs of the many different patients that will be in your department each day, and by following the recommended staffing guidelines, you're setting your department and your techs up for success, and providing the appropriate numbers of staff to assist with patient care. As always, thanks for listening to this episode of First Case Articles on the Go.